Anti-helminthics are the drugs that are used in the treatment of worm infestation, both within the intestinal tract lumen or in the tissues of the body such as the liver. We know that the helminths are classified into the roundworms and flatworms. Roundworms are also known as nematodes. The flatworms are further classified into the flukes, that are trematodes, and tapeworms, that are the cystodes. We'll discuss drugs for them for each of these classes separately. The first type of drugs will be anti-nematodal, anti-trematodal, and anti-cystodal drugs. The first anti-nematodal drug to discuss is albendazole. Now this is the one most important drug that you need to remember. The second drug is mebendazole, Ivermectin, Diethyl Carbon, and pyrantel pamoate. The first drug, albendazole, has a broad spectrum of activity and it is highly active against most worms. The active metabolite of albendazole is sulfoxide, which has a wide tissue distribution including the hydatid cyst. That's why it is preferred in this type of infection. Its mechanism of action is by binding to the beta-tubulin microtubule and inhibiting its polymerization. It also inhibits glucose transport into the parasite, and thus the parasite is immobilized and dies. The side effects are rare, but on long-term use it can cause hepatic dysfunction. They are mostly used in nematodal infections, of course, neurocysticercosis, and is preferred to praziquantel, hydatid cyst, and filariasis. The next drug is mebendazole, having the same mechanism of action and mostly administered orally. It is excreted in the feces mainly and is contraindicated in children less than 1 year and pregnant women. It is used in intestinal nematodes and trichuriasis, and in this case it is better than albendazole. The next drug is diethyl carbamazine. It acts by damaging the microfilariae membrane, which is then killed by the host defenses itself. It is safe in pregnancy, and one side effect, that is a hypersensitivity reaction known as Mazotti reaction, can be induced while therapy by diethyl carbamazine, because when the parasite is dying, it releases some substances that are antigenic that leads to this reaction. As it is a hypersensitivity reaction, it can be treated with antihistamines and glucocorticoids. The next drug is ivermectin. It acts by opening chloride channels and also increasing GABA transmission within the worm. Both of these things will lead to hyperpolarization and thus paralysis of the worm, which will then fall off the gut wall. Mazotti reaction is present in this case as well when it is used in the treatment of filariasis. Pyrantel pamoate is an agonist at the nicotinic receptor present in the muscles, and by continuously stimulating it, first there will be contraction and then there will be paralysis, that is spastic paralysis. The worm will fall off the gut wall, and it is mainly a drug of choice in filariasis because it is cidal and thus will decrease the transmission, and also in tropical eosinophilia. Praziquantel, which is anti-trematodal, will increase calcium influx and leading to contraction and thus paralysis, and also increased vacuolization of the worm, which is a process that precedes cell death, and it also has a high first pass metabolism in the liver and also a high plasma protein binding. Its common side effect is dizziness, and it is used in schistosomiasis and neurocysticercosis as an alternative to albendazole. It should not be given in pregnancy. Lastly, we have the anticystodal drugs, which include albendazole, Albendazole, praziquantel, and niclosamide. Niclosamide acts by inhibiting oxidative phosphorylation and thus kills the worm. Its main action is on adult worms. That's all.